my name is Carly, and I am a student physical therapist at Campbell University. Today, I'm going to demonstrate a muscle energy technique for the lumbar closing dysfunction. But first, let's talk about what muscle energy is. Dutton states that muscle energy is used to treat somatic dysfunction by restoring the muscles around their joint to their normal physiological state. With somatic dysfunction, there is usually an asymmetric movement pattern with restriction in one direction and increased motion in the opposite direction. Muscle energy techniques require the active participation of the patient and are thus viewed as mobilization techniques which utilize muscular facilitation and inhibition. In a study by Wilson and colleagues, a clinically significant improvement in Oswestry Disability Index scores in those who received muscle energy plus neuromuscular reeducation and resistance exercises as compared to a control group who received neuromuscular reeducation and resistance exercises. Although this article focuses on treating those with lumbar opening restrictions with muscle energy, we can reasonably apply this model to our patients who have closing restrictions as well. Another study by Schenck on the effects of muscle energy techniques on the lumbar range of motion found that those in the treatment group consisting of muscle energy for a closing restriction 2 times a week for 4 weeks showed improvement over the control group who received no intervention. Okay, after determining which segment of the lumbar spine has the closing restriction, you're going to have your patient roll over to their side facing you. Can you scoot a little bit closer to me, please? With the patient's permission, I'm going to ask, see if I can lift her shirt a little bit. Right, you're going to palpate that dysfunctional segment one more time. Right, once you found that segment, you're going to take the legs and position them into more extension until you feel that closing. I'm going to ask the patient to lift her top leg up against mine, and with 25 to 50% of her strength, push into mine, and we're going to hold for 6 seconds. Okay. Then you're going to ask your patient to relax. We're going to position them into a little bit more extension. Again, have the patient lift her leg using 25 to 50% of her strength, pushing against your hand. Hold for 6 seconds. And relax. And you're going to do that one more time by taking the legs into a little more extension. Have the patient push up against your hands. After 6 seconds, the patient's going to relax. And then you're going to slowly bring them back forward. And have the patient slowly come to a sitting position. So that technique we just did is what we call a muscle energy technique. And we were focusing on your lumbar spine, which are these 5 vertebrae right here. So what we like to see normally with movement patterns is that when you bend forward, these joints right here, the facet joints, open, and as we bend backwards, they close. So what we found with you during our evaluation is that when you bend backwards, those facet joints remain open. They don't close. So the technique we just did is to work on resetting those facet joints so that when you do bend backwards, they close with you.